Hi everyone, Angela here. So today I wanted to hop on and talk a little bit about red light therapy. Well, light therapy in general, but specifically red light therapy and near infrared therapy, because I think there are a lot of misconceptions about exactly what light therapy is. I know it's been so greatly commercialized that you see people using it just for face masks and things like that. And I think sometimes when you see something that's that greatly commercialized, I know it makes me more skeptical about how much it really works and is it just a fad or is something that can really help. So today I wanted to hop on and talk for all of my science geeks and nerds out there like I am. I wanted to talk more about the science behind light therapy, what exactly it does in your body. Why should you care about this? Is it really going to help you? If you should incorporate it as part of your wellness routine for long-term goals. So I'm going to talk about all of this stuff and more. As always, guys, I always appreciate if you give me a thumbs up to the video, subscribe. If you have questions or comments below, I'm always happy to help. Or if there's other things that you want me to talk about, I am happy to share my knowledge. So without further ado, guys, I'm going to get into it. It is called photobiomodulation. That is what light therapy is called. And the first time I had heard about it was probably about 15 or so years ago. I'd read a study on the National Institute for Health website about it being used for cancer patients that were receiving radiation treatment. A lot of times with radiation, unfortunately, you get these side effects for like radiation dermatitis, rashes, burns, skin issues like that. And they were doing studies with using different wavelengths of light therapy to see if it would help. And the studies were showing kind of across the board that it was for people that were using it before the radiation, during and after, it was reducing the incidence of any sort of radiation dermatitis. It was also decreasing the severity. And for people that were just using it after the fact, it was actually speeding up the healing process. So that was the first time I had heard of it. To this day, it's something to keep in mind that it's still really helpful for, especially because we've come such a long way with our red light therapy devices, something that's still used in the oncology field for those sorts of things. So there are a couple different types of light therapy. The first is blue light. So 380 to 500 nanometers is blue light. It's on the visible light spectrum. You can see it. Blue light is very, very, very superficial. So it's something you would use for very wound healing, but things that are like on the surface of the skin, for that kind of cellular repair that's just on the skin. So it's good for bacteria that's on the skin. It's good for antibiotic resistant strains of bacteria that are on the skin, like MRSA, things like that, because it helps break down the cellular walls of MRSA. So very superficial, only goes I think between 0.7 and 1 millimeters deep below the skin surface. So very, very superficial. And then we go into red light, which is 620 to 700 nanometers. So that's also on the visible spectrum. That's the light that you always see people wearing the face masks with. It's the red light that you can see with your eye. Also, you see it reflected on your skin. While I love that people are using it for their masks and on their head and things like that, it's good for so many other things. It is still superficial. It only penetrates between 1 to 10 millimeters deep. So we're still talking superficial, a little bit deeper than blue light, but this is something that's good for if you have any sort of very light discoloration on your skin, pigmentation issues, very light blemishes, nothing that goes too deep. That's what you would use that for. It is good for hair growth, things like that, because your hair follicles are very, very superficial below your scalp surface. So it's good for those things. If you have very light cuts, things like that, it's great for that. And then we talk about near infrared NIR, which is much deeper. And that goes from 750 to 1440 nanometers deep. So we're talking about, on most people, up to 2 inches, studies show, up to 2 inches deep from where you're placing it around your body. So this is going to lymph nodes, lymph vessels, deep tissues, muscles, deep muscles, organs, things like that. That's how deep this is going. I know there are rumors that I've seen online with people talking about, well, it's great for brain health because it penetrates so deep, it helps with your brain. But actually, there are no studies that I've seen. If you've seen something, I'm happy to learn, but there's no studies that I've ever seen that show that they penetrate the bone of your skull to your brain. I have not read those studies. I've kind of seen that debunked a bit by scientists. But for everything else, when we're talking about like organs like your thyroid, your stomach, things like that, your lungs, places like that, absolutely it can penetrate that deep, even to bones. So if you break a bone, that's why it's really good to use NIR for broken bones, things like that. Now, why this works or why it helps. I specifically want to talk about the NIR, the near infrared, which is the deeper one, the 750 to 1440. Now, most devices you find are just going to have like a 630 for just red light and like anywhere between a 7 and 900 nanometers for a near infrared. Like that's usually what you see on most devices because that's really the bulk of what we're needing. We don't really need anything deeper. You really aren't needing 1440. So that's usually the settings you're going to see. I want to talk more about the near infrared because I think that, and that is the light that's not visible to the human eye. So when you put on that setting, if you like flash it in front of somebody's face, they're not going to see it. It's not on the visible spectrum. This penetrates so deep and why it helps so much. So one is the first thing it does is it causes kind of like, you know how farmers sometimes like burn their field. You burn the field down because everything then grows healthier and works better then, grows stronger and faster, and it's very healing. It's kind of like that with our bodies. So when you're using the near infrared setting and it's going deeper into the body, it is causing heat right below the surface of the skin. And that heat is causing it's kind of a response of your body. Okay, this is heat. We have to come in here. We have to produce new cells. We have to heal this area. So it's kind of like a controlled burn sort of thing. So it doesn't do any serious oxidative damage to your body. It's just enough heat to start a response in your body to say, okay, that area needs more healing. Now, why it does that is because on a cellular level, that light wavelength actually goes deep into the cell and it stimulates ATP inside of your mitochondria. Now, from biology class, you probably remember your mitochondria is like the powerhouse of the cell, and the ATP is the energy the cell needs to repair itself, to heal itself, to do all those amazing things that we know our bodies can do. So that wavelength actually stimulates that production in the body. So it actually starts to tell your body to do some cellular repair. So deep level repairs. So this is why you find people trying to use it on things like bones or thyroids or areas like that. Like it's really helpful for people that have thyroid issues or Hashimoto's, things like that, because it helps the thyroid to say, hey, there's something going on. I need to produce new cells. And it's like, hey, I need to produce more. It stimulates nitric oxide production. Nitric oxide production, guys, that stimulates things like vasodilation of not just your blood vessels, but also your lymph vessels. So it starts to get everything moving, which is bringing more food to that area. It's bringing more oxygen to that area. So helps with healing on a literal cellular level. Why it helps with organs, the same reason. Like it's going into those individual cells in that particular organ and saying the same thing, like, hey guys, we got to get working. Now, the nitric oxide production I talked about, that does the vasodilation for your blood vessels and your lymph vessels. Why this is so awesome for people that have lymphedema or any sort of inflammation or swelling, histamine responses, which is a biggie if you're a woman in perimenopause. A lot of us have a crazy histamine response as we're going through perimenopause, especially at night where our bodies become itchy or we have a really hard time regulating, thermoregulation, which means we have a really hard time regulating our body temperatures, things like that. Well, that's why I do the red light therapy over my thyroid, just 2 to 3 times a week, because it helps that thyroid start working better. It helps all of my hormones to start moving better, because my body starts producing the hormones that it needs to start regulating things better. But going back to the vasodilation, why this is so awesome for people that have lymphedema or have had issues with lymph nodes being blocked or anything is because those wavelengths go deep enough to actually reach your lymph nodes and your lymphatic ducts. And because it's vasodilation, it gives everything more room. So it just widens the road better so that things can flow through it more. How lymphedema happens. So, fun fact, your lymphatic system is not a closed system. So your cardiovascular system is, all the vessels are closed. So that way the blood doesn't leak out of the blood vessels. But your lymphatic system, how it works is there are tiny little slits every way. So it's like little exits off of a highway at regular intervals. And so when you get injured in a place, because it has that tiny slit in it, that's why you get the swelling, because your body's like, oh, we have an injury. And then it can release more interstitial fluid there and begin the healing process. And the white blood cells, all of that is going. It could also remove the debris from the area. That's why it's so good. But people that have lymphedema and have that excess fluid, unfortunately, everything's just stuck there because your lymphatic system is not moving. And there are only two ways, as I like to tell you guys, there's only two ways that lymph fluid actually moves through the body. And one is through muscle movement. So your body moving muscles, with every muscle movement, as I've told you guys before, it's like gently massaging and inchworming the lymph fluid where it needs to go, which is ultimately your ducts. And the other way is manually. But unfortunately, if everything is so clogged up, it's really hard. Even with manual lymph drainage, we can only do so much. And that's why red light therapy is such a good helper, in addition to manual lymph drainage, or in addition to herbs that are helping to detox your body. This is a great complementary thing to use with that, because it causes the vasodilation. So like I said, it widens the highway so that things can move through better and easier. So it actually helps that fluid to actually move the rest of the way through, so that it's no longer pooling up in those areas causing the lymphedema. So that's why it's so helpful for that. There are a lot of studies on this that show that there is no harm to lymph nodes, lymph vessels, organs by using red light therapy. It brings oxygenation to areas. It helps with the cellular repair. Like, studies show that it is actually really, really beneficial and helpful, and healthier than regular sunlight. I am a big fan of just going out in the sun if you are able, but this is a very concentrated. So I will tell you, just like going out in sunlight, and this is why sunlight heals too, but it's the same way when we go out in sunlight, that people with more melanin in their skin. So people like me that have more melanin, unfortunately, our bodies, just the way our bodies have a natural sunscreen, so we don't convert a lot of vitamin D the way people with paler skin do. So people with paler skin, if you're watching, you actually have an advantage over people with darker skin. So for me, it takes me 2 to 6 times longer, which is crazy statistic, but it takes me 2 to 6 times longer to produce the same amount of vitamin D that it would take somebody 15 minutes. It could take me a half hour to 3 hours to produce. So if you have more melanin or pigmentation in your skin, you may need more vitamin D. So our melanin in our skin also does the same thing with red light therapy and near infrared therapy. So if you have more melanin in your skin, if you have more pigmentation, you may notice that you get a little bit warmer under your skin, because when you're dealing with near infrared, you kind of feel it deep into the tissue. You won't feel heat on the skin surface, but you'll feel it inside of your body. It's like a gentle warmth, but you will still feel it. And people that have more tan in their skin, so somebody like me, I feel it much more than someone who's paler. So you may find that you start to feel warm quicker. So just really be conscious of it, kind of be mindful. If after 3 minutes you feel the warmth kicking in, then you can stop. It also tends to not reach as deeply in people that have darker skin tones. So you may need to modulate the amount of time and the wavelength that you're using when it comes to red light therapy, which was very interesting to me. I noticed that really all a person needs is 3 to 12 minutes, like 3 to 15 minutes. You really don't need a half hour of this because it's doing all that work with heating everything up on the inside, like I talked about, and doing that with the ATP and everything beyond a certain amount of time. So beyond 12 to 15 minutes, you've already done what you needed to do, and it's not doing that anymore. You know what I mean? It's already absorbed in, it's already doing it. After that, you're not hurting yourself. In fact, it may actually be the opposite of beneficial because, like I said, a little bit of warmth under your initial layers of your dermis is fine. But now, if it's heating it up too much, you don't want to cause any stress to your body or damage. So we're just trying to give it a little push. We're not trying to shove it. So if you're doing like an hour in a red light therapy bed, you probably shouldn't be doing that. So less time is more beneficial, I find. And for places like my thyroid, I started off really slowly with just a shot of like 1 to 3 minutes, and I worked up, and now I do about 6 minutes. I hover it above my thyroid. And for places that have like very shallow cuts, and I'm just doing red light and not the near infrared, that I'm just shooting it with 2 to 3 minutes. Like, you don't need anything crazy here, guys. This isn't a crazy time consuming therapy. It's a very quick complementary therapy that you can do. I often do it at night when I'm watching TV or like in bed reading, like prop it up and do it. So all that said, I am a huge fan. As you can see, I'm very passionate about red light therapy, just like I'm very passionate about manual lymph drainage and lymphatic therapies, because I think they are things that can benefit every single person. I have never met a person that lymphatic drainage couldn't benefit in some case, unless you're under a doctor's care because you're missing some lymph. Which then your therapist should be in contact with your oncologist if it's for a reason like that. But honestly, I've never met a person it doesn't help. And I've never met a person that red light therapy can't work. You can use it on toddlers all the way up. Like, that's the beautiful thing about it. And when you're dealing with younger people, obviously shorter periods of time, because their layers are much thinner than ours are, and things produce very quickly. So when you're doing things for red light, when I'm hitting my face with red light or hitting my hair with red light, I know that that's just doing, like I said, very superficial. So follicular treatment for your hair, or very superficial pigmentation or blemishes, stuff like that. If I have very deep wrinkles, so for women or men that have very deep, like, your 11s are very deep, or you have very deep laugh lines, stuff like that, then I would hit it with the near infrared as well as the regular red light therapy. I would do both, because the red light, like I said, is just so superficial. We're only going 1 to 10 millimeters deep. And if you have very deep lines in these areas, you're going to want something that goes a little bit deeper to stimulate that collagen, that deep collagen production. So I would hit it with both. That's what I would personally do. But you can use this for all sort of like skin lesions, things like that. Alopecia, yes. Muscle aches, pains, breaks. There's so many benefits for helping your liver to function better. A thyroid, like I said, if you have stomach issues, if you're having reproductive issues, so if you have issues with that area, kidney, like, there's so many areas you can place this on and it will help you with, because it just helps with cellular repair. So the also amazing thing about this is, if you have old scars, so old wounds, things that have already healed, but you have scar tissue or something deeper going on, you can hit it with that. And there are actually studies that show it reactivates the healing process to that area because it goes deep into your cells to stimulate that ATP production. So even if you're going to tell me like, I've had this scar for 20 years, there's no dealing with it, still hit it with some NIR because it can go deep in there and you may be surprised with what it can do. While it may not be able to make it, take it away completely, it could certainly diminish it. It can also help with elasticity of the area. So it also helps with your elasticity, not just wrinkles and all that good stuff, but also the elasticity of the skin. So if you have something that has a lot of scar tissue buildup, and if you know anything about scar tissue, if it's deep, it can actually impede muscle movement. It can be very painful. So this is a great thing in conjunction with another modality like somebody that does like deep massage or scar tissue release massage, something like that, along with your creams, do something like this. So it is such a great complementary modality. So that's all I know about light therapy. If you have questions or comments, again, please write it below. Please, again, like this video. And if you like me, please subscribe to the channel. I'm always appreciative of new subscribers. I will talk to you guys soon. For the next video, I think I'm going to be talking a bit more about some herbs for detoxing, stuff like that. So fun stuff. So I will talk to you guys soon. I hope you all have a blessed day.